What I saw today with Clarius is really fantastic for the people that work on the field. My name is Harald Gärtner. I'm from Germany. I'm a sports scientist and I work for a private university, and I'm lecturing there for sports medicine, for training in general, and for sports rehabilitation. What we did today was a real data study. First, we did the knee in the athlete at rest, and the athlete got to his practice, and you could see the changes in, let's say, his knee, what kind of structures are affected from training, and this is really transferable to the everyday training. Because in the everyday training, then when you can really see structures changing in the session, then you know if the training parameters like volume or intensity are right for the athlete, or if you might adjust those parameters as an athletic coach, as the head coach, or the person who is in charge for taking care of the athlete. I see the use of Clarius for once in the injured athlete who is returning to practice, because you can then really do before and after sessions and see if the progressions you have for the athletes working or if they're too much. The second use for Clarius is for your athlete in prevention of overuse injuries, because it's not that you use it from day to day, but let's say from every 2 weeks, you could really see, okay, has the structure changed because of more training load you're applying, of more intense training you're applying, and it's time to back up your parameters to go down with the volume or down with the intensity. For me as a sport scientist, one really important thing is that one could do really cool studies with it, so to see how structure is impacted from practice or from competition. And because it's the handheld, it's really portable. You could do it on a field, you can do it on a baseball court, or you can do it in a gym setting. And that's what I think gives great opportunity for a lot of studies that could be done in the future.